Hello everyone, and welcome to another episode of Let's Talk Health. Today we are going to talk on shoulder pains. And to discuss this, we have today with us a consultant orthopedic surgeon, Dr. Hari Krishna, Citizens Hospital, Sheringampal. Good evening, doctor.
Good evening.
So before we start, I request you to give a glimpse on your expertise.
So, hello everyone. I'm Dr. Y. Hari Krishna. I'm an arthroscopy consultant at Citizens Hospital, Nalagandla, and I expertised arthroscopy in under Dr. B. Chandrasekhar Sanshan Hospital and also Dr. Sonnery Cottet in France. And now I'm practicing arthroscopy at Citizens Hospital.
So, coming to the question here, doctor, what are some of the common causes of shoulder pain?
For shoulder pain, there are many different causes. The main four causes that we regularly see in the OPD are frozen shoulder, also called as the adhesive capsulitis. The second is subacromial impingement, and 3 a rotator cuff tear, and 4 arthritis in the shoulder joint.
So, coming to the next question, doctor, what are the symptoms of shoulder pain?
So, depending on the pathology that they have, the symptoms differ from one patient to the other. When a patient has frozen shoulder, they have difficulty in elevating their shoulder with pain and restricted movements in the shoulder. Usually it is a global restriction of movements where all the movements will be restricted, like going back or increasing their elevation. And when it comes to subacromial impingement, their symptoms are specifically they have a painful arc where when they are trying to elevate their shoulder, they have pain during this movement, but there is no pain above this and there is no pain below this. And when it comes to rotator cuff tear, they have they will be able to raise their shoulder, but with the difficulty when they have a partial tear. And when they have a total tear, they won't be able to lift the shoulder at all actively, but they can lift it passively, that is with the other hand. Okay. And when there is arthritis, they do have movements, but they are all painful.
The next question would be, what are the factors that increase the risk of shoulder pain?
The most common factor is diabetes, like any other disease. So people who are for a long time who are diabetic, they usually have this frozen shoulder problem, and they're prone to have rotator cuff tears and arthritis in the shoulder. And the other group of people are young people who go for unsupervised heavy weight training. They too will suffer with either rotator cuff problems or a subacromial impingement.
Next question is, doctor, how is shoulder pain diagnosed?
So to diagnose, mainly the shoulder pathology is a clinical diagnosis than a radiological. So first, a thorough examination of the patient is very much required, because when it pertains to the shoulder pain, usually the pain will be from around the shoulder only. So anything below the elbow or above into the neck is not from the shoulder. So that has to be clearly seen in each patient. So when people have their pain below the elbow or above the shoulder, it is usually a cervical spondylosis, which is mistaken by mistakenly they think that it is from the shoulder. So the treatment completely varies. So basically the clinical diagnosis is more important in our practice. Then after that, a simple X-ray is the first thing that we order, and then an MRI to know the rotator cuff, because in X-ray we can diagnose up to the bony problems, and when it comes to the soft tissue, we need an MRI.
So the other question is, what are the treatment options available for shoulder pain management?
The treatment options, in every pathology has different kinds of treatment. So for frozen shoulder, it is mainly physiotherapy. So you have to defrozen basically the capsule is tightened in frozen shoulder. So you have to loosen that capsule by physiotherapy exercise. But the pain that the patient has can be treated by simple medication or intra-articular steroid injection, or in refractory cases where there is no improvement for months together, we can try an arthroscopic capsule release. When it comes to subacromial impingement, usually the pain subsides with simple physiotherapy and subacromial injection, and can be PRP also. And when it comes to rotator cuff tears, a partial tear can be treated with an intra-articular PRP injection at that tear site, which is ultrasound guided. And when it comes to a full thickness tear, the only way to treat it is arthroscopic cuff repair. And lastly, the arthritis. The initial stage of arthritis can be treated by simple physiotherapy, like any other joint arthritis. But a full-blown arthritis, like a grade 4, can be treated by only shoulder replacement.
When is the surgery advised for a shoulder pain?
So, for shoulder pain, usually we treat it by physiotherapy only. Only after a good trial of physiotherapy of say 2 to 3 months, if the patient is still symptomatic, only then we go for surgical options. Otherwise, we tend to treat them with physiotherapy or simple intra-articular injections.
Doctor, how much time does it take to get some relief from shoulder pain actually?
So all these are soft tissue problems most of the time. So usually they take around 2 to 3 months of good physiotherapy, a supervised physiotherapy. That should do.
So doctor, next would be, can a person with shoulder pain do basic exercises?
So coming to the exercises, see, it depends on the pathology of the patient. When it comes to simple frozen shoulder or subacromial impingement, yes, they can do all sorts of exercises. But when it comes to a rotator cuff tear, they have to be very careful because if they do any activities with weights, it could worsen their tear. So for people who have rotator cuff tear, you better not do any physical exercise. But the others, yes, you can.
So the last question for the day would be, sir, can shoulder pain be prevented?
To some extent, yes. So my advice would be people who are diabetic or when they feel like their shoulder is getting a little stiff, better start consult a doctor first, obviously. So after that, the earlier they present to us, the easier it is to treat them. So yes, that it can be prevented by kind of a physiotherapy that they start earlier, because before the shoulder gets stiff completely. So there, that crucial period is where we can treat them and prevent from having a full-blown disease. Yes.
So finally, doctor, what is your opinion, or what would you suggest like to finish this shoulder pain like?
So my take-home message from this live video is that whenever you have a difficulty in raising your shoulder, but you are able to elevate it with the other shoulder, with the other hand, you might have a rotator cuff tear, which is better if you come early, we can treat it better. So whenever you have this, you are not able to lift it actively, but you are able to lift it passively, please visit as a doctor. The second thing is the frozen shoulder. If you have a difficulty in reaching your back or reaching your like while you are combing, reaching your head, that is usually they have a frozen shoulder. So the earlier you present to us, it is a simple physiotherapy can treat your disease. So visit a doctor the earliest when you have the symptoms.
Okay. Thank you, doctor, and it was a valuable time and valuable session on this. So thank you, viewers, for joining us today, and we'll be back with another episode of Let's Talk Health next week. Thank you.